Hello everyone, my name is Tammy Islam, and my research proposal is about the knowledge, attitudes, and intentions toward unprotected sexual behavior among adults with severe mental illness in Los Angeles. Mental illness is a condition that affects a person's thinking, feeling, or mood. 43.8 million American adults experience mental illness in a given year, which means 1 in 5 adults in America experience mental illness. Now, severe mental illness refers to a wide range of psychiatric diagnoses that have common psychiatric symptoms which persist over time and are functionally disabling. These symptoms can affect daily life skills, family relations, educational attainment, work productivity, and social functioning. SMI includes schizophrenia, schizoaffective disorder, bipolar disorder, major depression, autism, and obsessive compulsive disorder. Some facts about SMI. Nearly 1 in 25 adults in America live with this serious mental illness, which means that's 10 million people. 1.1%, meaning 1 in 100 American adults live with schizophrenia. 2.6% of American adults live with bipolar disorder. And 6.9% of American adults live with major depression. Another thing to note is that depression is the leading cause of disability worldwide and is a major contributor to the global burden of this whole disease. While some SMI individuals have long periods during which they're well and are able to manage their illness, many individuals with SMI have difficulties in establishing stable social and sexual relationships, which brings me to the problem at stake. The prevalence of HIV is higher among individuals with SMI than individuals in the general population. And this is due to their high-risk sexual behaviors. For example, unprotected intercourse, multiple partners, sex trade, and illicit drug use. Rates of HIV infection and transmission among those with SMI are as much as 76 times higher than in the general population. Apart from abstinence, which is 100% effective in HIV prevention, consistent and correct condom use has been found to be the next most effective way of prevention. According to the World Health Organization, a large body of scientific evidence shows that male latex condoms have an 80% or greater protective effect against sexual transmission of HIV and other STIs. In other words, condom use is a key component of HIV prevention. There are several literature studies pertaining to the prevalence of HIV and its correlation to individuals with SMI. However, a majority of them are just that. For example, they asked, do adults with SMI have unprotected sex? Yes. And here are the rates of sexual activity. Is sexual risk reductions needed? Yes. And are they working? Fortunately, they are, and evidence from several intervention studies suggests that risk reduction interventions tailored to the mentally ill can help patients to increase condom use and other risk-reducing sexual practices. However, continued research is needed to understand better the psychological and social factors that increase the vulnerability of individuals with SMI. One of the studies reviewed suggests that psychiatric illness may impact HIV risk through multiple pathways such as social impairment, disorganization, social isolation, and that these factors may interfere with their sexual behavior. So that was something that was very interesting. I found that several research studies utilize the theory of planned behavior to determine condom use and HIV prevention among adolescents, college students, and adults, but only one research, to my knowledge, was found on applying this theoretical model in promoting condom use among the SMI population. Another thing to note is that there seems to be gender differences, there seems to be gender differences, but it's a bit unclear. One study that I researched found that there was no differences between male and female patients on a 7-risk measurement survey. However, a separate study stated that women showed greater risk reduction than men. So it's a bit unclear. The purpose of this study is to further understand the knowledge, attitudes, and intentions toward unprotected sexual behavior among adults with severe mental illness in Los Angeles. Concurrently, the study will examine the relationship between gender and sexual protective behaviors. The study hypothesizes that women will demonstrate a more favorable attitude toward condom use. Okay, so this study will have a purposive sample of 100 participants, and they will be recruited from inner city outpatient mental health treatment centers in Los Angeles. A trained master's degree level interviewer will be available, and they'll approach potential participants to explain the study and of all its content. Methods of recruitment will consist of contacting local providers and provide them referrals, flyers, and also doing email blasts to local treatment centers. Potential participants will be excluded from the study if they do not meet the following criteria. The inclusion criteria includes being a resident in LA County, being diagnosed with the SMI, being ages of 18 to 50, and reporting of a sexual activity in the last year. So the theoretical framework that we'll be using for this study is the theory of planned behavior. The key constructs that will be used are attitude towards the behavior, subjective norm, perceived behavioral control, and behavioral intention. Just a quick breakdown of the constructs. So behavioral intention is the motivational factors that influence a behavior. Attitude towards the behavior, which is how the participant feels about the given behavior. In this case, how they feel about condom use and how they feel in general about unprotected sex. Attitude also consists of behavioral beliefs and outcome evaluation, so that's something to keep in mind. Another construct is subjective norm, which is the social pressure to perform or not perform a given behavior. And the last construct will be perceived behavioral control, which refers to people's perceptions of ease or difficulty of performing a certain behavior. This study will have a mixed method approach, meaning that it will have both qualitative and quantitative measures. We'll have a qualitative interview, and that will be a face-to-face, semi-structured interview that asks participants about their attitudes and beliefs about mental illness, about HIV and AIDS, and condom use. The questions will be open-ended. And then we also have a quantitative survey for our quantitative measurement. And this will be used to gather demographic information, sexual behavior, and attitudes and beliefs associated with unprotected sex and condom use. Questions here will be close-ended. So qualitative studies about SMI can describe the experience of mental illness from the point of view of the person, but they cannot describe the distribution or frequency of that experience. And that's the reason why the study will be doing both approaches. So for data collection analysis, each participant has been given a unique will be given a unique 3-digit identifier number. Male subjects' ID numbers will start with 100 and it will be sequential, and females will begin with 200. All interviews will be audio taped for the qualitative data. And then once they're audio taped, they'll be externally transcribed into a Word document and put in line numbered form to be read and analyzed in detail. From there, they'll be put into categories so we can categorize the themes that took place. For the quantitative survey questions, they'll each have a rating scale and will be placed in numeric format. The data will be analyzed using SPSS. And then when reviewing the gender-specific qualitative variables, we'll be using the factorial ANOVA test. In conclusion, we need further research assess the attitudes, beliefs, and intentions associated with condom use among individuals with severe mental illness, while risk reduction interventions are working for the general population, further understanding of the views and perceptions of the specific community can help improve future HIV risk interventions. And that's it. Thank you very much.